back to the Markets with Mike. If you're just joining us, I'm Leah Patterson and I'm here with investment advisor Michael McGlunn, and we are talking about the staggering costs of healthcare in retirement. According to Fidelity, you could spend up to $172,500 on healthcare costs in retirement. How does this tie into the rest of your retirement income plan?
Well, that's a huge part of your retirement income plan because you're talking about a lot of money per month as you stretch that out over time. And it's a big part that people forget to include in their retirement plan. So it's very, very important to make sure that you've included potential healthcare costs, cost of your Medicare supplements, cost of your Part B premiums, possible estimates for out-of-pocket costs depending on what kind of coverage you've got, so that you know how that is going to deplete your savings. Because if that's not part of your kind of monthly magic number that we've talked about in previous videos,
right,
then you're shorting yourself and you're actually pulling out more than what you expected. So it's really got to be a part of your overall plan.
Michael, for someone listening right now, what's the first step they should take to help protect themselves?
Well, really the first step, as we always say, is you need a retirement income plan. You need to sit down with somebody that understands Medicare supplements, how they work together, and how that rolls into it. And you need to make sure that's being included in what you're spending monthly inside that plan, so that you know how long your assets are going to last you and if you've got enough to cover those costs.
So Michael, what are some of the advantages of someone working with a financial professional like yourself?
Well, if you've got somebody who is familiar with Medicare and healthcare costs and different things out there, that also has access to supplements and various things like that, they can really give you a good understanding of how they all work together. Because there's a big difference, and a lot of people, you still watch stuff on TV about Medicare Advantage plans, Part G supplements, Part F supplements, all of those kind of things, but they can really help you break down what is it that you actually need, how do the rules work, because they're all very complicated. It's not a simple just you turn 65, you sign up for everything, you get everything in place, and then you can just change whenever you want to. That's not how it works. There's rules, there's open enrollment periods, what are the costs, what do they cover, and how they work together. And just to give one little snippet, like with Medicare Advantage plans, it's kind of an HMO managed where they manage your Medicare and your supplement all together. And it doesn't operate the exact same way as just standalone Medicare or a supplement plan operates. So you need to make sure that you've got a full understanding of what all your options and choices are out there.
Absolutely, and there is a lot, and it is overwhelming, so we are here to help. On that note, if you'll go into the article highlights of the week.
Yeah, so of course the whole video today is about the rising cost of healthcare and what that's done. You said at the open, $172,500 of lifetime average healthcare costs. That estimate assumes enrollment in Medicare Parts A and B, and in Part D, which is prescription drug coverage, does not include long-term care. So if you have to have nursing home health care, those kind of things is not included in that. Dental, vision, over-the-counter medications, those aren't really included in that estimate. 17% of respondents to the survey that came out with this number, they have said they have taken no action to plan for health costs in retirement. 1 in 5 never consider healthcare in their retirement plans, and among Gen X, that goes up to 1 in 4. So 25% of Gen Xers haven't thought about healthcare in their retirement. So it's really something that is not being planned for that really should be.
Absolutely.
So let's talk about a little, what did it cost? What did it cost? Okay.
All right.
Today we're going to talk about a gallon of milk. A gallon of milk. So do you know what a gallon of milk costs today?
I should know this because I have a 3-year-old and we buy milk weekly. What is it? $4.15, $4.50.
You are so close. $4.03 is the average cost of a gallon of milk. $4.03. So if we go back 50 years to 1975, what did a gallon of milk cost in 1975?
$1.
Close, $1.57.
Wow, pretty expensive.
$1.57 per gallon. And 20 years ago today, in 2005,
$2. $2, $3.
$2, $3?
$2 or $3.
$3.20.
Okay.
$3.20. So really, milk's only gone up 83 cents per gallon in the last 20 years.
That's not terrible.
It's not terrible.
It's not terrible.
But
it's not great, but it's not terrible.
Two
I mean-
14-year-olds at home, it's pretty bad.
Yeah.
So,
Yeah.
but, well, in addition to the price of milk going up, the price of healthcare keeps going up. And if you save for your retirement, you want to be sure that you have a full and long-lasting retirement income, and you need a plan that includes those healthcare costs, those rising healthcare costs, and a strategy for dealing with that. And this news today could be a wake-up call to you. So those rising medical costs can eat away at your savings pretty fast. We offer a no-cost, no-obligation analysis and review of your current plan so that you can see what realistic medical expenses could be. Design a plan that kind of helps you to preserve your savings and your income, and make sure that that lasts you throughout all of your retirement years. Optimize Social Security, manage the impact of taxes, manage the impact of your income on your Medicare premiums with that wonderful friend of ours named Irma, while giving you confidence that your retirement is going to be solid.
As we've said before, your health matters and so do your finances. You should have a plan to help you preserve both as you are retiring or nearing retirement. So bottom line, if you are ready to take control, give us a call today at 256-467-4382.